state issued an alert about a rare bacteria that can cause what is known as flesh-eating disease after a swimmer in Falmouth was infected. Here to talk about this is Dr. Peter Chai, an emergency physician and medical toxicologist at Mass General Brigham. Dr. Chai, thank you so much for joining us. We're talking about Vibrio bacteria. What is that, and how rare is it to see a case like this?
Thanks for having me on. So Vibrio is a bacterial infection. It lives in warm waters, so we don't see a lot of it here in Massachusetts, more on the Gulf. But it can cause severe skin infections. It can cause gastrointestinal illness as well. We see it more in the summer, and now with more warm days, especially at the beaches and stuff, it is definitely a source of concern for individuals who are swimming, especially if you have open wounds and things like that.
But it's rare, correct?
Correct. It's a rare disease, and it's easily treated. We have antibiotics that treat it. People who are not immunocompromised and are otherwise healthy. This is an infection that can be treated with antibiotics like any other infection. So
you say the words flesh-eating disease. It sounds scary. Not everyone who's infected with this bacteria gets that condition, correct? Is this flesh-eating disease, is that necrotizing fasciitis, and this is totally separate from it, or is this the first stage on its way to that?
So Vibrio is one of the strains of bacteria that can cause what's called necrotizing fasciitis. That is a severe, what we would call flesh-eating bacterial disease, but that doesn't happen to everybody who gets Vibrio. So that's kind of a later stage of what would be a pretty severe infection.
Yeah, that's for sure. The state advisory issued yesterday that's meant to warn people that there is bacteria in our coastal waters. A lot of people go to the beach this time of year. We don't want to panic anybody, but what would you like to tell them?
Well, I think if you have an open wound or you just had surgery, for example, you're probably not the right time to be going into beach. Maybe you can just enjoy the beach out on the beach without getting into water. And if you do get a wound, you cut your foot on a shell or something like that, it's just always important, like any other wound, to do local wound care. So wash it with soap and water after you get out the beach. Make sure you keep it wrapped up and watch it for signs of an infection. And if you do worry that it's infected and you have symptoms like fevers or you have abdominal pain or diarrhea from these things, seek a healthcare provider to get evaluated.
Oh, we really appreciate this conversation, Dr. Chai. Thank you so much. Stay well.
Thank you. You too.